My name is Annie Coles and I'm the Director of Care at Hesse Rural Health's aged residential facilities. When the time comes for families to consider residential aged care, it can be an emotional and confusing time. At Hesse Rural Health, we strive to make this process as simple as possible. To be eligible to enter any Australian residential aged care facility, an aged care assessment or ACAT is required. Independent health practitioners make a time to come to your home to talk with you about how well you are managing day to day. They will determine your eligibility for aged services. There is no cost for this assessment. For an ACAT assessment, you can ring 1800 200 422 or visit the My Aged Care website. After being assessed as eligible for care, or at any time, we would be delighted to take you on a tour of our wonderful facilities. We will answer any of your questions and provide you with an information pack. You are most welcome to revisit as often as needed. We recognise that making the decision to come into aged care is not an easy one. After your tour, if you would like information about fees and charges, we would arrange for you to meet with Brodie, our Aged Care Business Officer, who will explain to you the costs of care and accommodation. How much you pay depends on your financial situation, and it is important to know that the Commonwealth Government sets the maximum fees for care, daily living, and reviews how much a facility can charge for accommodation. You will need to complete the Request for Combined Assets and Income Assessment form contained within the information pack and submit it to Centrelink, who will advise Hesse of maximum amounts they are able to charge. There are 3 charges applicable to living at Hesse. The standard basic daily care fee contributes to the day-to-day living costs such as meals, cleaning, wages, laundry, heating and cooling. For a guide, this equates to 85% of the single aged pension. The means tested care fee represents an additional contribution to care for people whose assets and annual income exceed thresholds set by the government. An accommodation fee pays for your accommodation. Depending on your assets level, the Commonwealth may pay some or all of this fee. You may also wish to seek independent financial advice for reassurance. After touring the facilities and understanding more about the fees and charges, you may like to be asked to be placed on the waiting list for the next available room at Hesse's facilities. Currently, our waiting time ranges from immediately up to 6 months. We will keep in touch with you during that time in case your care needs change. When a place becomes available, we will contact you to see if you are ready to move in. You, your family or representatives will meet with our CEO and Aged Care Business Officer to sign a resident agreement. We will do our best to make your move to residential aged care an easy and smooth transition, and we'll work with you to understand how best we can do this for you. It really can be that simple. If you're thinking of residential aged care for yourself or a loved one, please give us a call. We are only too happy to help.